Hello, everybody. Welcome to HBMA Live. I know you must be missing me because it's been a long time since I have done one of these shows. But thank you very much for joining us today because we have some amazing perspective. It's this perspective we are going to talk about a physician's perspective for EMR. That's a one thing we are going to talk about. But before that, our regular promotion about HBMA. HPMA is of course holding our conference, one of the largest conference. It's in September 15th to 17th, St. Louis. Those who are still interested, we still have some seats left. We still have the hotel still has rooms. So if anybody wants to go on hpma.org, register for our conference, and we are going to see you there. I want to talk about a few things before we invite Dr. Arthi Sanjeevi, and I want to talk about a little bit of our today's session, what exactly I'm going to talk about. So one of the things I have been talking about in my live sessions is about how public policy defines the standards for innovation. And it sparks opportunities for new innovations and product development, and especially in the healthcare startup space or revenue cycle management companies who wants to do new product development into this space. So I'm going to give you some data about EMR because EMR has been a very, very interesting topic for last 15 years at least about innovation. So I don't know, I'm going to share some data with you. You probably know about it, but today we are going to talk about some data which will give you a little idea how EMR came into the effect. So the first law which has come up was the Health Insurance Portability and Accountability Act, which is popularly known as HIPAA. It was passed in the US in 1996. And that was the beginning of EMR era. That was the beginning of EMR era. People started talking about digital protection. They are talking about identities. People started talking about medical record storage and different ways how to transmit medical records and all of that started coming up in 1996. Actually, that was the first law. And then as of 2006, about 10 years down the line, the first EMR was the Computerized Provider Order Entry, CPOE, that existed for more than 30 years. But in 2006, there were about 10% of hospitals that had a fully integrated system. So in 2006, actually, hospitals starts adopting CPOE. And then by 2008, about 62%, you would see there was a survey by Des Roche, and they said 4,484 physicians that were surveyed. 62% people says that 80% primary care physician and 86% of non-primary care physicians, they had no EHRs. They were talking about EHRs, but at that time in 2008, virtually there was no EHRs. But in 2009, if you see, in 2008, there was another survey was done where 66% of physicians says the reason they don't have an EMR or EHR is because of the cost barrier. So think about it. We have been talking about public policy until 2008, only 20% EMR adoption rate. And why there was 80% people did not have EHR because of the cost as a barrier. So in 2008 and by 2009, CDC reported that there's a one, in 2009, the Congress included, if you remember, Obamacare was launched, and they incentivized each physicians up to $44,000 through Medicare and $65,000 through Medicaid. And that was the beginning of real EMR era in physicians space. That's when the physicians started coming up. They started adopting the EMR and rest, it provided a lot of opportunity for revenue cycle management companies. It also provided opportunities for healthcare entrepreneurs, IT companies, different type of vendors. So today I'm going to talk about the journey for last 10 years, especially in EMR. And I have an amazing guest with me. Her name is Dr. Arthi Sanjeevi. I know her for many, many years. She lives in Tampa Bay, beautiful family. She has two kids and a husband who is a gastroenterologist. I'm going to invite her shortly. And welcome, Dr. Sanjeevi, to the show. Thank you very much for finding some time for us. I hope you can hear us.
Thank you, Kunal. Thank you for the kind introduction. It's always a pleasure to chat with you, formally or informally.
This is
And I
fantastic.
consider it an honor that you invited me on your platform to discuss the physician's point of view.
So let me give you a little background what HPMA does. I don't know if you were able to hear it or not, but HPMA is one of the largest organization into healthcare business management.
Mhm,
And I've been their member for last 20 years. And most of their focus is for non-clinical performance related issues in a medical practices.
mhm,
And they have been advocating this for a long time. We have a board. I'm one of the board members. I hope that we would receive some board members who would be listening today to us.
mhm,
um, our goal is basically to educate people, and especially those who are into healthcare space, about anything related to non-clinical side. Where are the opportunities, where we can innovate, how we can do better billing for physicians. So that is the goal and mission of HPMA. We have over, I mean, our LinkedIn group has over 25,000 members who are, associated
mhm.
with us. So there may not be many people listening as of this moment, but this video would be circulating widely. So many people would be listening to you in next few days, hopefully. So again, thank you and welcome to the show. I really want you to give a little bit background of your clinical side and what is your passion, because I know you are a very passionate woman when it comes to medical care. So give us a little bit background about yourself.
Thank you, Kunal. So, my name is Arthi Sanjeevi, and like many other physicians of my cohort, my initial medical schooling was in India. I'm a graduate of Madras Medical College. I came to this country in 1998, and my initial training in internal medicine was in University of Nebraska. I subsequently did my GI fellowship in Medical College of Wisconsin and my advanced fellowship in therapeutic endoscopy in University of Minnesota. So my training period in this country was from 1999 to 2006. That might give you a perspective on the time
So,
period.
so,
And
so you remember those days when we used to dictate, and then there were tape recorders and dictations used to
yes,
go.
yes, I think it's my generation that was very much in the transition zone of experiencing this whole digital revolution. So our training did not involve much digital exposure, and it gradually got incorporated. A lot of our learning only happened on the job. So during med school days, nothing at all. And even during my residency time, we used to carry this clunky pagers. Our chart system used to be divided into a column of two-thirds and one-third, where two-thirds the doctor scribbles our interpretation of our document, and then we write orders for the nurses on this corner. And so it was all by the phone on the wall. You'd see the message come on your pager, you'll call and give an order to the
I
nurse.
still
And
remember those pagers. I still know some doctors who use those pagers. Do you
yeah,
carry one?
I used to, yeah,
You-
not anymore, because these days everybody send their information to the smartphone. You're
Right.
kind of a slave of the iPhone that you carry around, or any other smart device. But that
Yeah.
used to be the method of communicating our orders. So
Do you
the
miss those
e-commerce
days?
slowly crept in. When it first came, it was fascinating. For younger doctors like me, we thought like, wow, this is what medicine needs to be. This is so disorganized, but it actually put some of our senior doctors into retirement. They just vanished. They said, I'm not
That
doing.
is true. I know some of them too.
I remember something funny. One of the patients on the floor had severe back pain, and neurosurgery consult was requested. So the progress note basically was a line struck across the page with a signature. So the nurse came up to me and said, "What does this mean, doctor?" And I was familiar with it. I said, "I think the surgeon is telling you won't touch the patient with a 10-foot pole." You cannot get
Oh
away
my
with
God.
that kind of a progress report in the EMR days.
So, do you still dictate or you don't dictate anymore?
Not anymore, not
Not
anymore.
even in the hospital?
Well, we have a sensitive device called M model. So we build right now. Things have morphed into, we have EMRs, we have templates. So each physician customizes their template, and then you dictate too, but on a device that recognizes your voice, and it automatically generates, and then the system generates the codes. And a lot of
So
times when
we were discussing this, and you were talking about that you're not very happy with the template-based system. Tell us your experience, the story you were telling me about one of the patient called you and he wanted you to change some codes. What was it about?
So there are two issues.
Yeah,
Periodically, the templates make us time efficient. So
correct.
the reports need to have certain components. So the templates are generated, and then you go fix and make changes. And sometimes when you're busy, there is an oversight. I'd occasionally get a CT report on a woman that says the prostate was of normal size and shape. We would just laugh about it. But for some people, it becomes a very sensitive issue, particularly those who take the magnifying glass and go read line after line. So, in addition to the template, the latest change in the healthcare system has been that we are obligated to share not just the summary, but the entire physician assessment and plan. Everything is obligated to be shared with the patient. So, the incident that we were talking about a few days ago is, I had this patient with a complex GI issue. We went through the details of a thick chart with everything that had happened. We came up with this complex algorithm of what investigation is needed, who she needs to be referred to. Actually landed up spending a full hour with the patient. But she calls my manager a few days later because she's had access to her report, and she's looking at every line. And on the physical examination, there was a mention that the thyroid was of normal size and shape. And patients like, I don't think the doctor looked at my thyroid at all. I mean, I'm a gastroenterologist.
So
That's
now
not
they started reading it and they started criticizing and seeing
correct.
the
They're
things
going
and
line by
everything.
line.
Yeah.
And so she wanted a refund of her copay and the amount that she's going to be
Oh
charged.
my
And she
God.
wanted the billing to be downgraded because she didn't agree with those parts of her body was touched. It was generated by a template. In my opinion, I've put in a
I
lot of
know some
thought.
of the doctors, they don't share the medical records on progress notes with the patients. Is it
It's
okay
been a
or no?
recent obligation that we do. So, right, more recently, patients have access to everything.
Correct, that's true. Especially after I think the Trump has passed a law for My Health e-data or something,
Correct.
where patients have access, if they want, they can have the access of their medical
Yeah.
records.
I mean, there was one other issue where patient gave a lot of personal history. Now, obtaining personal social history is very relevant in regards to the bearings it has on a patient's medical history. It's very relevant because the choices they make in life has impact on their health.
Correct.
Um, but when the patient actually read my documentation of what she herself admitted, she didn't like the optics of it. So I actually had a patient rewrite her entire consult note, and she wanted me to edit everything according to her diction because she didn't want the world to see what I thought of my clinical assessment of her was. So it's kind of, it's coming up to this whole situation of if
This
people
is
are
very
writing their own
challenging,
biopic, they shouldn't come to me for a clinical opinion.
That is true, actually. If I think from a patient perspective, I remember, so when I was a student, I used to smoke. I don't smoke. I have never smoked, I never smoked in the last 25 years. So, but whenever you go, they capture your smoking history and smoking cessation. So it's very difficult sometimes as a patient also to mention whether I should mention that or not, that I used to smoke, or because there is a question, have you ever smoked? Did you ever smoke in your past or something? So sometimes it's a little tricky to answer these template based questions. And so it's an issue with the patients as well, not just as a physician, but these
It's
things
true.
are
So,
subjective.
in regards to smoking, for example, the transparency that the EMR is bringing, say some person applies for disability insurance or they want life insurance,
Correct.
then that's going to be dinged. So, you're going to feel compelled to hide facts because of the transparency in your medical record. On the other hand, if your doctor doesn't know about your smoking history, say you're talking about a sporadic smoke during your college time, but if there is someone hiding the smoking history, I'm going to miss an opportunity to diagnose a cancer related to smoking.
Even
It,
25 years ago.
I mean, it progressively drops, but you see the pressure on a patient,
Correct.
if their medical records are going to be transparent to anyone providing them with any kind of insurance, they're going to hide facts, which
And
means
then who
it
is
doesn't.
responsible? You as a physician is responsible for that.
I'm not doing the best job for them if there isn't honesty. And if
Correct.
the transparency is going to limit honesty, then it affects the quality of my medical care for the patient.
Well, by the way, you're talking about transparency. Let me tell you what's coming next in billing.
Hmm.
Price transparency is going to be a big thing
Hmm.
in next few years, where as a physician, not only you are obliged to show the data for the cost of care,
Hmm.
but your insurance is also supposed to give you the data about your contracts and then make it public. So I don't know how it is going to happen, but it's going to open up a lot
It's
of
going to
other.
open up a big can of worms.
Correct. It
I
is
don't think
definitely
it's physicians personally who are going to have to be that much worried as much as organizations.
correct.
I think physician component of a lot of say procedures I do maybe 10% or even less. There is a
Correct.
lot of facility fee, ancillary fee, and it's very complex. So one of the big limiting thing right now is when I see a patient and I tell them this is what you want, I'm not in a position to even tell them what their cost is going to be. It's a complex analysis between what they've agreed with their insurance and what the system is going to charge. So I do think it's a positive thing. Our healthcare expenditure in US is like $4 trillion.
Correct.
It's ballooned out of control. And I think are moving from a simplistic state of medical care to the sophistication has
Mhm.
contributed to it in a big way. We do a little too much. So I think it's time to bring it to a middle ground right now. As much as the sophisticated medical care sounded really great to me and was the lure for me to even move to this country to practice medicine in a state of art way, the complexity of medical care right now is robbing the joy out of most physicians in just going back to what they originally got into the profession for. So I think most of us in my cohort are like wanting to go back to the simplistic pleasure of being a physician
So
that
that
is caring
yeah,
for
that
patients.
that triggers in my mind because I remember those days when you go to the doctor's office, he used to touch you, he used to ask you questions, he used to look at you face to face, in eyes. And now it's totally different. Either he has a computer in front of him or a laptop, or he's looking into his phone, Googling something. How do you
Yes.
see this whole thing? Because how do you find it? Do you find it? It's because you were talking about the joy of rendering healthcare,
Right.
and how do you
It
see this?
causes a major professional attention deficit disorder. Like it's an adult onset attention deficit because I can't focus on the patient in person because his EMR requires attention too. And there are boxes to be clicked, and I'll be dinged if I don't check a
So
few
when you
boxes.
see a patient, you are sitting in front of the computer at the same time, right?
I personally don't. It's
You
just
don't.
my
So you
choice.
still talk to the patient, and then you.
Yeah, I 100% look and interact with the patient. But as a result, I've negotiated for a scribe to
Correct.
be there for me to do this documentation. It adds to the overhead of the practice,
Correct.
but I'm very particular about I don't want to be looking at the computer. I want to look because there is a lot of intuitive pickup a physician does by connecting with the patient, being in their energy field and understanding what is wrong with them. But when you're just looking away from there and you're just looking at progress note after progress note and all the other doctors assessment, you're biased by other people's assessment. I mean, it is history, but at the same time, you're not able to connect with the patient and find out exactly what they are dealing with. So I use a scribe to document. Now, is it completely the best case scenario? It's not me actually creating the note. Templates are used, scribes are used, but it balloons out the doctor's overhead. So productivity, if you look at productivity before the time of EMR, when I could just write a little bit of an assessment, I used to be able to see twice as many patients. So I think even analysis, when they looked after the EMR has been implemented, physicians are able to collect more money, but that's more because of the coding and everything that is incorporated into it. They're collecting more money from the ancillary expenses that are billed, but we are not actually more efficient. Our efficiency has been cut down a lot. We are working and seeing way less patients, but at the same time, we are getting exhausted a lot
That
because
is
you
true.
get
It's
into this
very
business to
stressful
be
just
sitting
by
with a
thinking
computer all
about
day.
it. Yeah. So sometimes when I see, just reporting somebody on a regular basis, to me, like if I'm a doctor, like if somebody has put a kind of, it sounds very stressful that you have to report everything as it is, and if you make a mistake, you're going to be penalized for. So it's just the idea itself is so stressful for
Yeah,
some doctors, and then you are doing it 5 days a week, every day.
yeah.
Every patient you see, you have to. So how do you cope up with this stress? Do you think it is stressful, or it is not as stressful anymore? Now you are habitual of it.
Well, you get habituated to it's like the frog that is sitting in a pot of water where you slowly dial up the temperature.
I like your analogies all the time. It's
Yeah,
very
the frog
funny.
doesn't know it's like getting cooked, but I think periodically physicians need to hop off this
Yeah.
pot and embrace passions outside of just being the doctor and the care provider. Just embrace the fact that they're human who are entitled to have their own time with their family and follow their passion. Of course, it doesn't help that your phone is constantly blowing up with, doctor,
Does it
doctor, help
impact the
me.
personal lives as well?
Yeah, I think our profession and personal life integrate a lot. It's very enmeshed. I mean, you land up if you're in a environment for long enough, you'll end up becoming physicians for a lot of patients, So it's a life choice where you really can't separate your personal life from your profession. But that said, yeah, the stress is there for every physician. It's about how you develop a resiliency with it and how you cope with it. But also being advocates in talking with the system. Previously it used to be doctor, patient, and a nurse helping you take care of the nurse. Do you realize, in my perspective, I think the entire concept of having physician extenders in the form of physician assistants and nurse practitioners purely came about, I think, as a byproduct of having EMR and IT came between the the physician and the patient. As a result, a lot of nursing responsibilities has been delegated to entering computer orders right now, that they don't have much time to interface with the patient or assist the physician in taking care of the patient. So we invented this entire realm called physician extenders in the form of PAs and extenders to take care of patients. So it's created a job market, but it's also ballooned up the healthcare expenditure overall.
Which is true, but it's both ways. At some point you think it's a cost, but at the same time, it helps reduce some of the overheads and some of the stress being a physician you can take. We spoke about, see, with this whole thing with the Google and Facebook and social media, patients are more engaged with
Mhm.
physicians. I have seen this over a period of time, especially last 5 6 years. Patients go back home, do Googling, and then come
Mhm.
back with prepared Google answers for you. So, what are your thoughts about this whole engagement, and especially the inclusion of social media? How do you see yourself? Like, is it more challenging for physicians to cope up with more aware or more empowered patients, I would say. Empowered, socially empowered patients.
Yeah, yeah. I think you asked two questions in one with your
Right.
question. The one thing is about how do I cope with patient engagement. I personally actually engage, I really enjoy an informed consumer, an engaged patient. Unless a patient is engaged in their healthcare, it's kind of, it's a moot point. You can't take them. It's a partnership in getting them to a better state of health. So even though it may take me a little bit more time to address their questions, I really enjoy having a patient who's engaged, who's educating themselves, who are really wanting to get better, as compared to taking on someone who has some ancillary secondary benefits from being a professional patient and is constantly looking for medications and a diagnosis. So that part I really enjoy. Now, the second thing you're talking about, social media, as some doctors use it very well for marketing purpose. They have a good page set up to get their patients to talk to them. Patient
To
portals, for
educate
example.
patients, basically, they use it to educate patients, right?
Right. And I think some of them have launched it in a very,
Correct.
systematic
Professional
way,
way, and
which
they're,
is a good thing. I've personally followed the principle of let my work speak for itself. I've not really gone on a limb to market for myself. It's just and I'm busy enough doing that. When
the
I take good
referrals,
care of
the
a patient,
in-house
yeah, they
referrals.
bring in the entire family. So I'm busy for the next 8 months and I've not really
I
tried to
know
do
that for
it.
sure. One of
Yeah.
our friends tried
But
to
it's not a bad
take
strategy at all.
appointment from you.
Yeah, but it's not a bad strategy. I think if you do not define what you stand for, and someone else will define it. So I think it's a great way to share a platform of education for your patients, that people
Right.
are able to have that interest or additional help to set up a platform to educate their patients. I think it's a great thing. And a smart consumer always gets better out of the deal. I also personally encourage patients to maintain their own folder instead of just showing up to the appointment and saying you have EMR. Why don't you just grab the information? Just like how you maintain your own financial portfolio, you have your
So you
taxes.
ask your patients to do it.
Yeah, because I still like to smell paper and see all the results. And I tell them, like, understand what you have, form your own, portfolio, and keep track. If possible,
Correct.
create a
Like a
summary of
financial
what all you have.
portfolio, your bank
Yeah,
paper
so
system.
like a financial portfolio, you should have a health
Yeah.
portfolio where you're organized and you have everything on one page. Say one day a patient walks into the doctor's office and they have a sudden EMR outage or something that nothing is available. Instead of rescheduling, you can come up with your own paperwork. But the other problem, if you realize, if you have any IT shutdown, even if I am there and my patient's right there in front of me, and I have all the tools, I cannot touch the patient because the data has not been put in the computer system.
Yeah, that is a big challenge of this EMR. And I don't think so other so one of our clients had this issue. What we did
Mhm.
is we installed Tesla wall. This guy paid for the Tesla wall and he said, I don't care. I just and even if it happens like 2 or 3 times in a year, when we live in Florida, hurricane comes, electricity goes down for 12 hours or more. He said, I want so Tesla probably is the answer, or have a fully self backed up system where your internet, your servers don't go down.
Correct.
but
Yeah.
but you are right, it's a big challenge with the IT stuff.
Not even with server going down with power, there have been some instances of data breach, security issues coming up,
Yeah,
which has been increasing. There's a lot of attempts to breach personal information.
yeah,
Even that causes a temporary freeze and a shutdown. And it's very disruptive in a physician world to have even one day's shutdown, because where are you going to
it
accommodate all
is
these patients?
you are, I mean, if you're seeing 20-25 patients a day, then it's
Right.
not only a loss of business, but it's a loss of those patients are backed up, for next
Correct.
schedule. So you
Yeah.
basically go on your boat and take a day off. That's what you do. Oh, well, we had a great conversation so far. Do you have any thoughts on what do you think about these patient reviews? Because I remember you mentioning to me sometimes they are annoying, sometimes people don't understand it, but most of the time, patients are kind to you. And so, what's your thought on patient reviews? That's my last question, by the way.
Yeah, even when the administrators sit down to talk to the doctors about, how well you're performing, they bring up this thing called Press Ganey scores. And
Uh-huh.
they talk about, like, oh, uh, I think this month, 40% of your reviews were not spectacular. So it's
Oh
like,
my
okay,
God.
how many reviews did you get out of the 200 patients I saw? It's like five. So is that is that a number enough to tell
Uh,
you if the patient's good enough or not? So, one of the things we talk about is the number needed to even make any kind of analysis useful. Um, this is the way I look at it. There is an old Indian story about the saint who sits under a tree. And then this gentleman goes up to the saint and says, like, I'm moving from this town to another. So tell me what kind of people live in this town. And he says, like, oh, okay, tell me about the town you come from. And he said, oh, they were horrible people. They were liars and they were cheats and they were misers. And I'm moving for a better ground. And he said, I'm sorry, son, this town you're going to still has, the liars and the cheats and the lowlives. And then, so his shishya is observing him. And then the next day, another gentleman comes by and he asks the same question. So, and the guru asks the same question, tell me where you come
you're
from.
coming
And he
from.
says,
Yeah.
like, oh my God, my entire village was my family. We really took care of each other, and honesty is supreme, and kindness is right up there. And he said, don't worry, the town you're going into is exactly the same. You'll connect with people. You're going to have a village around you in no time. And so the pupils around the guru are like completely like surprised, like, guru, like, how can you say such false things? Both the men were moving to the same town and you're giving completely opposite reviews. And he said, you know what? It's all a reflection of who they are. It's not where they're going.
Yeah.
And it's
What you
what
see. So you
yeah,
will
because
find the
you're
same
seeing
kind.
yourself in the people you
Correct.
interact with. So I think my thing has been, when a patient expresses immense gratitude, I don't let myself get too inflated because they are expressing their grace.
Correct.
And at the same time, when a patient is upset, I feel I have to have the
Acknowledge it.
resilience and acknowledge that they're not in their best state, they're suffering. And when someone is going through hardship in their life, you don't expect them to be in their best possible
It's true.
status. So you take it with a grain of salt. If you see there is logic in their, in their reviews, you make the remedy with your practice what you need to. But at
Correct.
no point I think you should take it home in a way that you're up all night because, oh my God, how could they think of me so badly? I mean, given the legal environment, we do need to take some additional measures to protect
It's true.
yourself. But I
Protection
don't
is very
think it
important.
should allow these reviews shouldn't allow you to define who you are in your core level. You should each one should practice the best they can and give to humanity what they're there for, and then I think the reviews will take care of itself.
Yeah. Well, fantastic. I think we can continue this conversation, but I know you have to go back, see your patients. Are you seeing patients for the rest of the day?
Yeah, I have some meetings and interviews and patients to take care of.
Well,
But
fantastic.
it's
I
fun.
think we had a we had a great conversation. Thank you, Arthi. Thank you so much. And I really appreciate. So thank you very much.
Thank you, Kunal. Enjoy
Thank you.
talking with you.
So with this, I am going to take a leave for today, but I am again asking everybody who's listening this, please listen it carefully. And then if you're a billing company, if you're a management one of the members of HPMA and has not signed up for our conference, fall conference is taking place on September 15th to 17th in St. Louis Marriott Grand Hotels. You can go on our website, hpma.org, and sign up for that. With this, have a great Friday and enjoy the rest of the day.